Hey everyone, it's Nurse Dani coming to you live today. I have Dr. Longenecker with me from Heber Valley Clinic. If you've never been to Heber in Utah, it's a beautiful place. It's close to Park City. You need to visit. And we're going to talk all things birth control today. This is probably the second most common topic that I hear about on Facebook. A lot of people have questions about birth control and what are the normal side effects and which one should I be on? And of course, people need to talk with their doctor and find out specifically what's best for them, but we can give some general information today.
Absolutely. Yeah.
Before we get started, tell everyone a little bit about yourself.
So my name's Dr. Longenecker. I am originally from California, but grew up here in Utah. My wife and I and my family, we did medical school down in Las Vegas, Nevada, and then we took a trip out to Detroit, Michigan for a while to do my residency there. I've been back here in Heber, closer to family, friends, and just loving Utah and all the great things that it has to offer. And we just love it here in Heber Valley. It's beautiful.
It is beautiful. It really, really is. Okay, so let's start with different types of birth control. If I were to come into your office today as a patient and say, I need some birth control, what would you tell me?
So I think one of the greatest things about birth control nowadays is there are so many different options. The important thing when a patient comes into my office is to find a birth control that's going to work well for her. It's not a one-size-fits-all question. Mm-hmm. And so you need to determine the individual patient's needs, what their desires are, what they're expecting out of a birth control. There's a lot of other non-contraceptive benefits that birth control can offer as well. So one of the first questions I would ask you is whether or not you plan on becoming pregnant in the next year.
Because the length of time you want to prevent pregnancy is going to determine the type that you should use, right?
Absolutely.
So if I wanted to prevent pregnancy for a shorter amount of time, what would good options be?
So whenever we talk about short-term birth control, we talk about things that are going to have a quick return to fertility for when you do want to become pregnant. Things like the birth control pill are acceptable.
How long does it usually take to conceive after you stop taking your last pack?
The birth control pill? It varies from person to person, obviously. The data and the studies that they've done say that between 30 and 90 days, you should begin having normal menstrual periods again. And if you're having normal menstrual periods, you could become pregnant. The studies that they've done over the course of a year suggest that people who have been on birth control pill previously 80 to 90% of the time will conceive successfully within that first year.
A lot of people are put on oral contraceptives to regulate their cycles if they've had irregular periods, right? And then when they go off, they stay regular and they're able to conceive.
Absolutely.
So it's used for that reason too.
Right, and we've seen a number of moms who, well, number one, get pregnant while taking the pill.
Yes, how effective is the birth control pill?
The birth control is very effective as long as you take it as you're supposed to. Whenever we prescribe the birth control pill, you should take it every single day at the same time.
And why is the timing in the day important?
Because it's going to help regulate the release of hormones from your brain that create a pulsatile sensation. And if that steady hormone level isn't there, your brain could
send a message for you to ovulate. Especially if you miss that pill around mid-cycle, about the time that you're going to ovulate.
Exactly. And so if you do miss a pill, don't worry. You just take it as soon as you can, and then jump on to the next day.
Should you take two the next day or just take one?
So if you remember within that first day, just take it as soon as you remember and then take it the next day. However, if you miss that full day, take two the next day.
Take two the next day, okay.
If you miss more than that, it's probably a good idea to just call your OB provider and get their input.
Maybe use some backup contraception to be safe.
Absolutely. Condoms are available everywhere. They're a great form of birth control, again, when used every single time. And so if you're ever worried about whether or not your own birth control is being effective, absolutely be safe, be proactive, and try to use some sort of backup birth control like a condom.
So what bleeding changes would a woman see if she was taking oral contraceptives? There are types where you can take it a specific way and have periods, and ones where you can take it and not. Explain that.
So whenever somebody starts on the birth control pill, there is a change where their endometrium is trying to
the endometrium is the lining on the uterus,
around
right?
the uterus that grows every month and then sheds off every month and then grows.
That's why you have periods. That's
sheds.
what's sloughing. Mm-hmm.
And so during the first little bit of taking the pill, that's becoming thinner and thinner and thinner due to the progestin in the birth control pill. And sometimes that becomes a little bit unstable. The estrogen component is what stabilizes the lining. And a lot of people get breakthrough bleeding. That should get better and better and better the longer you're on really any form of birth control. And so if you have some breakthrough bleeding or some abnormal bleeding over the first, 3 months or so, that's pretty typical.
To be expected. Nothing's wrong.
To be expected. Don't worry about it. But I mean, obviously, if it's really heavy, you're saturating, a pad every hour or anything like that, you do need to get in and be seen. But I usually say 1 to 3 months, let's see how this affects your body. At the end of 3 months, we usually have a pretty good idea, but don't be discouraged just because you're having some irregular bleeding during that time interval. Most people who take the pill take 28 days of active pill, and then there's 21 days of active pill, then there's a week where it's
7-day placebo to just keep you in the habit of taking it so you don't get out of the habit and have a hard time getting back
exactly.
on that.
And you should have a period during that week of inactive pill. However, the longer you take oral contraceptive pills, the more likely you are to not have that period. And so eventually your period may go away altogether.
So the mini pill, what's the difference between the mini pill and like other oral contraceptives that people would think of?
So those other oral contraceptives are called combined oral contraceptives, meaning they have estrogen and a progestin component, 2 different types of medicine. The mini pill is progestin only. It doesn't have any estrogen. We like to use the mini pill mostly right after moms have babies and they are lactating and they're breastfeeding. And the progestin only pill or the mini pill combined with breastfeeding is a very effective birth control option.
So safe while breastfeeding, that's one option a mom has while nursing. What are other options that are good while breastfeeding?
So there's a number of options that are safe to take while breastfeeding. One of the tricky parts, though, is getting through the first 6 weeks after delivery. We don't like to use combined oral contraceptives or the estrogen and progestin pills during that first 6 weeks.
So do you just recommend abstinence for the first 6 weeks?
Well, I do recommend abstinence for the first 6 weeks to all my patients. However, realistically, I know not everybody follows that. But you can start taking the progestin-only pill right away while you're breastfeeding, and you can do that through the duration of your breastfeeding. It's most effective during the first 6 months.
What if you start having periods while you're breastfeeding and on the mini pill?
Exactly, that's what I was going to say. Once you start having periods, however, even let's say you're just breastfeeding only, you start having periods, you need to know that you're not protected just simply because you're breastfeeding. And so you should talk to your provider about getting either on the mini pill or some other sort of contraception. So the other ones that are safe to use, the combined oral contraceptive is safe to use, but again, that's 6 weeks out and beyond. They have done some studies to try to see how the progestin and the estrogen influences breast milk production, and they've determined that it's probably okay. A small amount of hormone does go through the breast milk and does get to baby, but there haven't ever been any adverse effects really seen. And so we say if that's your choice, you're 6 weeks out, you can go back on a regular birth control pill. The IUD is a great form of birth control during while you're breastfeeding as well.
There's a couple of different types, right?
The IUD stands for intrauterine device. It's a small little T-shaped plastic device that goes on the inside of the uterus.
Some are plastic and some are copper, right?
Yeah, some are, exactly. They have a little wire coating around it. The copper one is beneficial because it's completely non-hormonal. It doesn't have any estrogen or progestin on it.
So it's basically like a barrier device?
It's not quite a barrier device because it's not actually creating a barrier, but in a way it does increase the cervical mucus in that area to inhibit sperm from coming up.
Kind of like a roadblock.
A roadblock, yeah.
Roadblock.
And so the copper is super beneficial because a lot of women don't want to take any hormonal contraception, and so the copper IUD is a great option for them.
Now, don't the copper IUDs cause a woman to have, like, you can expect regular periods and probably heavier than normal bleeding? Is that true?
Correct. And so when we talk about there's 2 broad categories of IUD. There's the copper IUD and then the IUD that has hormone on it. The hormonal ones are great because they usually lessen the amount of bleeding that women have with their periods. But the copper ones can be associated with a little bit of increased bleeding at the time of your period. Again, breakthrough bleeding is pretty common over the first few months, but that should get better with time with both types of IUDs.
So if you see a lot of unscheduled bleeding, spotting, even a little bit of heavy bleeding after it's placed, would that be normal?
It's very
and some
normal. Cramping, pain, a little bit of discomfort, both related to the procedure itself. I mean, IUDs do require an office visit in order to place them. It's not as simple as just taking a pill and kind of going on your way. It is about a 10 to 20 minute procedure where you're in the office and it's associated with some cramping, some discomfort. Ibuprofen works great to take care of that pain, but it should get better within a few days afterwards. But as soon as that device is placed, you do have a foreign body in that area that might take a little bit of getting used to, an adjustment, but most of our moms do, or our females do really, really well as time goes on.
What other forms of contraception would you recommend to a woman who's breastfeeding? So we've got the IUD, pill.
So we've got both types of IUDs. We've got the mini pill. We've got the regular combined oral contraceptive pill that you can begin a little later. Obviously abstinence during that first 6 weeks. And then really depending on when she wants to get pregnant again, we would kind of create a plan as far as what other ones are best to use. Condoms are obviously safe to use as well. Some of the other barrier methods like cervical caps and sponges and things.
They're a little bit harder to use.
They are harder to use.
They can slip out of place and maybe not as effective because they're harder to use, right?
Correct. And they're not as effective for a number of reasons, but usually it's a compliance type thing where people either forget or they just don't take the time to use it the correct way. And that's not their fault for any, you know, we're not blaming anybody, but it's difficult, you know, when you get into those situations and you don't remember, it's not available, you ran out, you know, things like that, and it's just hard to do.
What about implantable forms of contraception and the depot shot? Can those be used when someone's breastfeeding? So
the implant is very similar. By the implant, what we mean is a small device that goes up under the arm, and that slowly releases hormone as well. It's a progestin device as well, and so it's very similar to the IUD as far as its efficacy. It's very similar in its side effects, and it's very similar in breastfeeding as well, and so it can safely be used. Depo-Provera shots can be administered right after you deliver. They can be given in the hospital. That's a shot that you get once every 3 months. And so again, if you don't follow up with your provider in exactly 3 months, it's going to be less efficacious for you. However, it is safe to use during pregnancy and it shouldn't affect your milk supply.
So let's talk about the return to fertility after these few types.
Did I say pregnancy? I meant lactation and breastfeeding. Safe to
we
use
all knew what you meant.
Not safe for during pregnancy. Don't use it then.
Yes. Okay, so IUDs, let's start there. The return to fertility afterwards, how long does it usually take for your body to get back on track? Now, I think it's important for people to know you ovulate while you have an IUD in place.
Correct.
And so as soon as you have it out, the next time you ovulate, you could get pregnant, right?
I'm glad you brought that up. I just had a patient not too long ago who came in for her IUD removal because she was wanting to get pregnant. We took her IUD out, and she never had a period. Because she ovulated and got pregnant with that very next cycle. Now, that is not typical for IUDs. IUDs do have a little bit slower return to fertility, especially the one with the hormone component. The copper IUD, people return to fertility a little bit quicker. Over the course of 1 year, about 75 to 95% of women successfully conceive after that copper IUD is removed.
Now, it's normal for people to take like 6 months to conceive whether you've been taking a type of birth control or not. So there's just normal factors that affect it, not necessarily the birth control.
Exactly. Right? Any given couple, if everything is normal, they're healthy, they're able to conceive, usually only has about a 20% chance of conceiving any given month with unprotected intercourse. And so usually we don't even start to investigate why you're not becoming pregnant until after 1 year of trying with unprotected intercourse.
Now, the depot shot, that takes a while to return to a fertile state. And when we say returning to a fertile state, like once you're having regular periods again, you can assume that you're ovulating again, right? So it's important to track your bleeding patterns
Absolutely.
and watch them. And a normal cycle length, would you say, is like 25 to 35 days in length? So once you're seeing periods that are about that far apart, you
Right.
can assume that you're fertile again.
Yeah.
And possibly before,
Right, yeah.
if you get pregnant and then never have a period.
Exactly. Yeah, the depot shot is one of the side effects of that is that it does take longer than some of the other contraceptive methods to get back to that fertile state. And that's because it is so long acting. Again, it's a shot that you get once every 3 months. And so let's say the last time you take it, it's still effective for 3 months down the road. It's not like the IUD that is simply removed and you're on your way, or the pill you stop taking. You know, we're worried if you miss one day of the pill. So
Right.
Obviously, that first 3 months after the injection, you're still protected. But because of how it's slowly released from your body, and depending on how long you've been on that, and also depending on the fat content of your body, your weight has something to do with it. And people who are thinner or a little healthier weight return to fertility quicker than somebody who's a little heavier set. And they take a little bit longer to return to fertility when taking the depot shot.
So fat is essentially an endocrine organ, right? It affects our hormone levels. And so that too can affect fertility, because if you have too little of it or too much of it, that'll affect your ability to ovulate,
Absolutely.
right?
And so one of the things that I love talking to, our prospective moms about, people who are wanting to get pregnant, is weight control, adequately trying to control your blood sugar, trying to get down to a healthy weight, because you're anticipating going through so many physiologic changes during pregnancy, obviously a lot of weight gain because of the pregnancy, that it's a good time to optimize your health and get ready for the pregnancy that's coming.
A lot of people don't think about having a preconception appointment, but it is really important to make sure everything is as good as it can be before you conceive.
Right, and that's another great reason why we have contraception, because if you're not quite ready, and there are a few goals, a few things that you want to achieve before that happens, you can go ahead and plan that appropriately and make sure that you're ready for when that time comes.
Yeah, good advice. So for the implantable forms of contraception, how long does it take to return to a fertile state after they're removed?
So those are very similar to the IUD as well. Over the course of 1 year, studies have shown that it's not quite as quick as if you were taking the pill or the copper IUD. However, it's very similar to the Mirena or the hormone-covered IUD. As far as during that course of that first year, about 70 to 80% of people will successfully conceive.
Oh, that's great. So how about emergency forms of contraception? You've not been taking anything. You didn't use a condom. There was nothing on board, and you were like, uh-oh, I can't get pregnant. What do you do? What are your options?
So right now, I'm aware of about 3 different options. 2 of them are pill forms, and then one of them is that copper IUD that we keep talking about.
You can go get that in right after.
Correct.
Right? Yeah.
So there's about a 5-day window. Ideally, we would love it if you came in right away, within 2 or 3 days after you've had unprotected intercourse where you might have become pregnant. However, most of these medicines are effective up to about 5 days out from the unprotected intercourse event. So if you do go through that and you think that you're going to become pregnant, go ahead, come in. There's a pill called the Plan B pill. That one's available over the counter.
So you don't even have to go see the doctor. You can just go get it at a local drugstore?
You should be able to. I'm not familiar enough with Utah quite yet to know if that's available.
How widely available it is.
But I know in other states it has been in the past. So the Plan B is available, and that's the same hormone that's on the hormone IUD, the same hormone that's in essentially close to the same hormone that's in the implant. It's a progestin-containing pill that will help you not get pregnant. But again, it's most effective when taken within 72 hours, but it could go out to about 5 days.
And are there side effects associated with it?
There are. It can disrupt your cycle. It can cause a little bit of abnormal bleeding.
So that's important to note, because if you miss your period, then you still should take a pregnancy test to make sure that's not the cause. But if you're not pregnant and you missed your period, it could be because you used emergency contraception.
Correct. And there is a failure rate associated with Plan B and Ella, which is the other one, and the copper IUD placement. All those individuals, even though they're taking that emergency contraception, still could become pregnant. And so be vigilant, watch your cycles, watch your bleeding patterns, but it's a great idea to take a pregnancy test as soon as you miss your anticipated next period and see exactly what's going on.
That is the first sign of pregnancy, right?
Usually, yes.
Okay. So what about risks associated with different types of birth control?
So whenever we talk about the oral contraceptive pill, we never want our moms who are at risk of heart disease, who've had previous blood clots, high blood pressure, people who are smoking. We don't want those individuals to necessarily be exposed to the estrogen component in the combined oral contraceptive
because
pill.
It increases the chances of having blood clots and those problems.
It does
right?
increase the chances of some of those bad events. Now, that's usually a personal history of blood clots. Simply because, Grandpa Joe had a blood clot after a surgery doesn't mean that all of a sudden you're at a higher risk. It could be that's the case, but we prescribe birth control to people whose family have had a history of blood clots, and it's not associated with an increase in risk. But if you have a personal history of that, absolutely, we don't want to give you anything with that estrogen component in it. Other risks associated with it.
Like what about IUDs, for example? What risks are associated with their use?
So IUDs, again, we talked about the procedure of placing an IUD. Some of those risks actually occur during the placement. There's a small risk uterus, of what we call perforating through the uterus, and that IUD could then not be placed in the correct position to begin with. It's a very small chance, and obviously the more experience your provider has in placing them, the less likely that is to occur. But it is one of the complications. Again, it's a device that needs to be removed at some point. The IUDs are good.
A lot of people think they can remove them themselves. Do you advise against that?
I would advise against that.
And why? I think it's important for people to know why, so that they know why they shouldn't just go tug it out themselves.
Well, a great example is just a few days ago I had a patient whose device was not easily removed, and there was some excessive bleeding, and that's one of the side effects or the risks associated with IUD is a difficult removal, and sometimes we need to do imaging to see exactly where that's at. Sometimes when you do put the IUD in, there's some strings that come through the cervix that your provider should check on to make sure that they can see from time to time. Sometimes those strings go missing, and you're not able to remove it yourself.
Maybe they've coiled up there or something.
Right.
Yeah.
And it's more of a difficult procedure to try to remove that device. So that's one of the risks as well, encountering a difficult removal down the road that's not just as straightforward as what we would hope.
Are there any risks associated with the depot shot or implantable forms of contraception that people should be aware of?
So yeah, I mean, when we talk about risks, there's a number of benefits to these medicines, but there's also risks as well. Then there's side effects that people just don't handle well. With the depot shot, the breakthrough bleeding is the biggest complaint that I get.
For the first few months.
Right. And again, it should get better and better, but sometimes it doesn't. And people one of the reasons they don't continue with that medicine is just simply because of the side effect of the breakthrough bleeding. The implant in your arm, there's also the risk, just like that IUD can migrate somewhere else, the implant in your arm could move around as well. So we counsel all of our patients to check their arm on a regular basis to make sure they can feel it, because you can feel that device through the skin, and just make sure that it's always there.
What about weight gain? Are there certain types of birth control that are more likely to make a woman more prone to gaining weight while using it?
So the majority of the studies that have looked at weight gain during use of contraception have kind of pointed to the fact that weight gain is not necessarily caused by any form of
Well, there's so many other
contraception.
factors, right? Like
Exactly.
whether the other lifestyle choices the person is making, it's hard to do a study where all of those variables are
exactly
controlled.
the same.
Yeah.
And one of my favorite studies, they actually took two groups of women, and one had some contraception and one didn't, and they followed them over time, and they showed that about 20% of the people in both groups lost weight, and the same amount of people gained weight, and the same amount of people stayed the same. And so it's hard to say that it's actually causing the weight gain, but it's one of the most commonly reported side effects.
I went on this medication, I started gaining weight. What's my problem? Yeah.
And I think just with the passage of time, especially here in America, the trend is I'm getting older, I'm living longer, I'm gaining more weight. And I think a lot of people, just as time goes on, gain weight. And a lot of people want to look back and point to what changed, and the birth control pill is usually something right around those years where you're moving out of the house, you're hanging out with friends more, eating more pizza on the weekends.
Exercising less, yeah.
Maybe you're not participating in the high school activities that you used to do, and you're married now, watching more movies with your spouse on Friday night, and I don't know, it's just a change in lifestyle that there's a dozen different reasons why weight gain is happening. Sometimes the pill or the contraception gets the negative end of the stick, but I think there's ways to still be on any form of contraception and control your weight and live a healthy life.
What about like headaches and mood swings? Are there certain ones that make that more likely?
There are, and again, the thing with birth control is that it affects everybody a little bit differently. Headaches are a pretty common side effect in a whole number of different birth control options. I see a lot of headaches in my Depo-Provera injections, or the people who get that form. In fact, migraines, depending on what type of migraines you have, whether they have something we call an aura or any other changes along those lines, those could be reasons why we would avoid different types of birth control. But it's a matter of sitting down with your provider, explaining to them your unique circumstances, talking about what you expect out of a birth control, and finding the one that's going to work best for you.
I think that's a good place to end on, because that's really what it comes down to. Everyone is so individual. Everyone has different circumstances. What's right for one woman may not be right for another. So talk with your doctor. And if you're on a type of birth control that's not necessarily going well for you in your mind, then talk to them about other options.
Absolutely. Don't ever think that just because you went in and you got you decided on one, that's the final say. There's always different amounts of hormone in the birth control pill that you can try, different types of those hormones, a complete different type of birth control altogether. There's so many different options that there is going to be one that works well for you, and that
you just have to try a few to find that one. Yeah. Well, great information and great advice. Thank you so much, Dr. Longenecker, for taking the time to be with us today. I really appreciate it. I'm sure everyone out there appreciates it, because like I said, this is probably our second most commonly asked topic. So thank you so much. And of course, if you guys have any questions in the future, you know where to find me on Facebook. You can send me a message. And if you have any questions on the topic of birth control, you can put them below and we'll answer as many of them as we can. Have a great day.